Welcome to CFP Distilled March 2023. My name is Dr. Simon Moore.
And I'm Dr. Paul Dillon.
We're going to take the CFP journal content and distill it down into things you need to know for the CCFP exam and for clinical practice. But first, our usual cover critique. What do you think about this one?
I don't know. It's a bit, I don't know. It's either Botox or chronic pain. I can't tell. But you can use Botox for certain conditions in chronic pain.
There you go. Yeah, the article is about chronic pain, so definitely you're seeing the light side of that and the dark side of that. This person is suffering. Hopefully we can help them. We're going to talk about some conditions today. We're going to talk about bronchodilators in post-infectious cough.
We're going to pick on from that, and we're going to talk about CNS tumors in kids. What's that red flag? What's the line after which you need to get some imaging?
And then we're going to go with the flow, Flozins in CHF. So why don't we start with that? Should you be using the SGLT2 inhibitors in congestive heart failure?
So we have to divide congestive heart failure up into HPFREF.
That's right, HPFREF. Yeah, exactly. So I'm so confused here because I thought that drugs weren't helpful in patients with preserved ejection fraction. Their ejection fraction's over 40%. Why are we giving them medications if it doesn't make them live longer?
So there can be patient-oriented benefits, so less hospitalizations and potentially other ones that'll improve their lifestyle. So that's the positives for those. But how do you sit down and talk to your patients in a really patient-centered way? This article can help with that.
So there's a clinical decision tool you can use at the bedside. You show it to your patient. We'll put that up on the screen for you. You can see it talks about the pros and the cons.
Easy, red and green, something you can sit down at the clinic, at the bedside and talk to your patients about that. Heart failure, you can sometimes have a cough, but what we see more often is patients with a post-infectious cough or PIC. Tell me a little bit about what you can do to help these patients in a cough that lasts on average 20 days.
I work in family medicine, I work in Indigenous health, I work in urgent care as well, and this is one of the most frustrating things when people come and they say, I've been coughing and coughing and coughing, what can you do for me, doc? And aside from the honey and the lozenges and the saltwater gargle if they got sore throat, like there's really little we can do. So fortunately, there's a little bit of evidence on these puffers. So this one here, the blue puffer, Ventolin, actually not used in this study. They use a different one called Combivent, also known as ipratropium and salbutamol. About 68% of people are going to have improvement with cough at 10 days compared to placebo, about 40%. Now, the other option is going to be inhaled corticosteroids. Again, the benefits of that aren't that fantastic. 60% of people will have improvement at a couple weeks compared to 50% will have improvement at placebo. And that's really the takeaway point, the bottom line. At 3 weeks, most people are going to be much better. You got about 80% of people.
Amazing. So that's a great summary, great article to read for something that's common in family practice. What's our last article about?
So we want to take a closer look at imaging in kids. What is your next step? What is your next step to make sure you're not missing a cancer diagnosis?
So we know from the article that most of the CNS tumors in kids are infratentorial, and these can be notoriously difficult to diagnose because kids are going to come in with maybe a bit of lethargy, maybe a bit of somnolence. It could be a post-viral thing. How do you decide when you need to get imaging? The answer is 4 weeks. Earlier, if you've got some red flags, but at 4 weeks, these kids, if they have persistent symptoms, are going to need imaging. What imaging? Well, CT, because it might be more available.
Not if you're on a SAMP exam. CT is not going to be your first choice.
Great catch, Simon. So CT head or MRI head, which is your gold standard.
Got to list the body part on the SAMP exams.
So there you have it. And what's a quick, easy way to remember? I looked at this. It says 4 weeks. These are the UK guidelines. This article recommends we use those. 4 weeks, 4 head. So 4 weeks. If those symptoms are ongoing, you're going to need to move on to getting some imaging to find out whether there is a CNS tumor or not in kids.
That's it for the CFP Distilled March 2023. We hope you're looking into signing up for the review course August 2023. We're going to be coming to Toronto and going through all 105 topics in 2 days. For the review course for CFP Distilled, my name is Dr. Simon Moore.
And I'm Dr. Paul Dillon.
See you next month.